It's Time Out with Bill Boggs.
Phyllis Diller. You know what Phyllis Diller says about her body? The only thing left that's original are the elbows. All right, let me introduce you to our two new guests. With us right now is Dr. Helen Colen, who is a plastic surgeon. Ask your question. How do you feel about this? If right now you could wave the magic wand of a plastic surgeon to change your looks, like our guests have done, what would you do? Let's meet our first guest. Here's Leslie Adcock. Leslie, what have you had done?
I had a breast reduction with an uplift and also a tummy tuck.
All right. Sylvia Donor, what have you had done?
I've had work on my ear and I've had my nose redefined.
Francine Nessif, what have you had done?
I had my nose done about 22 years ago and a chin implant last year.
I thought you were going to say I had my nose done 22 times. Joe Hitchner, how about you?
I've had my nose and chin done.
All right. Let's have a nice welcome for all of our guests. Thank you very much for coming.
Welcome.
Obviously, you're pretty happy with the results, or you wouldn't be sitting here on television, right?
Very happy.
True.
Good. Well, let's get into some of the things more specifically. Now, Leslie, you say you had a tummy tuck and a breast reduction.
With an uplift.
With an uplift.
Yes.
Why?
Well, I had 4 children. My oldest child is 20. Then I have a child that's 17, 6, and 2.5. And after 4 children, I had a lot of stretch marks on my stomach, tremendous amount of excess skin, and I was a little over 40 pounds heavier than I am right now.
So was it a tough decision to get to?
Very difficult.
Were you afraid?
I was frightened to death at first, and then when I started to research it a little bit, I had gone to one of the plastic surgeons, and I wasn't too satisfied with the way I felt comfortable with, and I went to Dr. Colen.
Well, you look pretty good. Just stand up.
Thanks.
Let's take a little bit of a look about what the progress is.
Yes. Well, thank you.
All right?
Thank you.
Now, Sylvia, we'll hear more from all of our panelists. Sylvia Donner, multiple face procedures, ears reshaped, nose done, and we have a before and after picture. Why, basically?
Well, with the ear, it was a matter of not being comfortable with the protrusion. As far as my nose was concerned, it's an aesthetic feeling that you want as much perfection as you can get on your face, and there are things that just don't get better with age.
Nose
and
being one of
the
them.
nose being one of them, especially with the genes in my family.
Oh, you got big nose genes in that
Yes,
family?
yes.
Well, I think people can identify with that. Let's take a look at the before and after photograph here of Sylvia. That's the big nose genes. And woo! Magic, huh?
It really is.
You feel a lot better about
It's
yourself. I can
incredible,
tell.
yeah.
You do feel a lot better about yourself. Francine Nessif, you had nose surgery and chin.
Implant.
I don't know much about that. Before we hear from you, let's take a look at before and after here of Francine Nessif. All right, that's before. Let's see that. May we see the before again? Let's look at the chin specifically.
It wasn't strong enough for my face. I was self-conscious about my profile. When I had my nose job done, I didn't know what kind of nose to ask for, and I just told the doctor at that time I wanted a long, thin nose. Felt my nose was too big for my face. Felt that I couldn't redo my nose again, and felt that I had to enlarge my chin in order to match my nose, which took me 22 years.
Is there anything else you're interested in being?
I think eventually a temple uplift.
A temple? Well, what would that do?
Just to lift up the eyes. I'm not ready for this.
No.
This is what I was told by Dr. Colen, perhaps in a couple of years.
We will meet this doctor, and we'll meet. Same question to all of you. Self-image, mental attitude, tell me about it.
I know for myself, I was very, very embarrassed of my looks. Not so much to what anybody else thought, because it was, something that you wouldn't see above the clothes. But my self-esteem had greatly improved. I feel much more confident. It had nothing to do with the fact that I wanted to wear bikinis or expose myself. No, that's not a necessary thing for me.
Because I was saying, we always have some in the back. The crew has a bikini supply. We can get you them. The rest of you, self-image.
I think the self-image is what improves more than anything else. I think that what you see in the mirror is very secondary to what goes on in your head.
It's pretty much
just
the same for both of you? Well, how about your friends? Do your friends react to you a little bit differently as a result of this?
most of my friends do not realize that I've done anything.
I hope some of them watch this program so they know.
They will now.
Really? Same with you?
My family was the only people that knew. I didn't tell anyone, and my company now and my friends now all know.
Yeah, so
about being here.
Well, in your case, it really is a very private thing.
It's extremely private.
You know, how about now? You've just had the breast and the stomach. You look great, but would you consider, as time passes, doing anything to the old face?
I
don't mean the old face. I mean the face, the new
medium-age face.
Yes, the middle age.
I would. I feel positive enough about it, but I don't think I'd overdose on it.
Right. So there's a denial factor. Is that something you find in all of your practice, that, you know, people come in, they want their names changed, they don't want their friends to know, it's a secret, they want to look better, but they don't want people to know it?
Well, I think most people when they come in, they don't want to advertise that they want something done. But I do think that when people come in, they want to feel more positive about themselves. And they want to improve themselves. And I think it's available and it's safe. And if a person is a positive person, knows what to expect, I think it's perfectly okay.
What are circumstances under which you would turn someone down?
Well, very often you would have a patient come in and say, look what I had done and look what the doctor did to me. Isn't this terrible? And you look and it's a perfectly acceptable result. So you right away get a red flag that this person has unusual expectations. Perhaps they cannot be fulfilled with surgery. And those are the type of patients to watch for.
Elizabeth Taylor claims in USA Today, that she's only had this part removed, that she didn't have a facelift. What do you two doctors say?
She most likely had tightening of her neck with some facelift, because you can't just remove this. You have to remove it somewhere.
Well, you're on the table.
Right. Well, you can't just cut it out. You have to pull it.
Now, we have some graphic photographs. That usually means you're going to see something that might be slightly shocking here. But this is part of the medical procedure. All right, let's take a look. First, nose job. These are generic before and after photographs. Okay? Go to the next one, please. All right, now, this is not a tattoo. These are, will one of you doctors explain what this is?
This is a patient who had droopy breasts and large breasts. And this is right prior to surgery, where I drew the pattern where I want to place the nipples and how much skin I would like to remove.
All right, and we saw little dots there in the middle of the...
Right, that's where the new nipple position will be.
All right, now let's take a look at the after. Whoa, that's a rather involved operation, is it not, Doctor?
That's correct.
How long does that take?
Takes about between 3 and 4 hours, because you have to reduce the nipple areola. You have to redrape the breast. You want to preserve sensation. You want to have minimal scarring, so you have to take care in stitching. And you also remove breast tissue, and you have to make sure that both breasts look the same.
Leslie, this is what you had done, right?
Yes, I did.
Can you tell us a little bit about what the procedure felt like, when you got out of the hospital, physically what you felt like, psychologically, and how, you know, your husband reacted to you?
Well, first of all, you have to understand that I did both operations together.
The tummy tuck and...
That's right. Because of my time factor with working, I work almost to the extent of 2 full-time jobs. So the surgery itself took over 6 hours, I believe, at the time. And quite frankly, it didn't feel comfortable afterwards. But
you weren't about to, you know, go do trampolining?
No, not at all. As a matter of fact, that I was in bed for probably 2 or 3 days. And then I was released from the hospital. I went home, and I stayed home for about 4 to 6 weeks. And during which time that I was told that I had to get up and start standing up and straightening up more and continue to walk. But the pain was minimal compared to the results that was received.
It really must require a certain amount of courage to go through with this, I think.
I don't know if it's courage. It was really a matter of the fact that, to be very graphic with you, my stomach had looked like a road map. And I'm talking about incredible excess skin and stretch marks all over, even above the belly button.
Because it's hypothetically,
And that's not there.
If you hadn't had this procedure done, if you hadn't gone through with this, how would you be a different person today if you hadn't elected to do this?
First of all, I would still be heavier. My weight loss had something to do with up here.
I see.
Because that triggered off something positive for me, because I felt as though that I was always hiding under the additional weight. And no matter how much weight that I lost, I still wouldn't feel comfortable with the way I...
What can go wrong in a situation? That's a serious operation.
the risk of bleeding and scarring and asymmetry, infection, etc. And these are the major
Asymmetry
problems.
would be...
So with the breast.
You go through the whole thing and... Eek! That's not the way it's supposed to be.
Okay,
Well,
but-
you usually mark the patient beforehand. You take care of that beforehand, just like you saw the markings on the screen.
So you're working right on that.
So you have to go according to a plan. You don't just go in and do the operation. Well, most patients who come in and a doctor may suggest something to them, they may buy it. You see, the idea is to, if they go to a doctor, they ought to have an idea about themselves. What do they want? And if a doctor suggests something to them, they ought to think about it before saying, okay, do it. To, for example, to go through pictures, have pre-op pictures, draw on it what it will be, discuss the complications of every procedure, and discuss the limitation, what you can do with that particular nose, or with that particular eyelid, or with that particular breast.
So let's just talk about kind of that group of people that I'm sure you must see in your practice, where my face is done, it wasn't right, I need it done again. I had it done at 40, now I'm 45, I don't quite look the same as I did 2 years after the surgery. I can't handle the change life brings.
We have one of our guests our guests who moved down to the audience for a question or comment.
I sort of disagree with you because I failed to mention before I had 3 chin implants. I wasn't happy with the first one because I felt it was too strong for my face. I was used to a soft chin. I went for the second one with Dr. Colen. She performed all 3. I felt it was she uplifted my chin more so, and I'm very satisfied with it. I didn't feel like I was looking for so much self-improvement. I just felt that this wasn't me. I was used to a smaller chin, and this is what I wanted.
Dr. Colen, what's the problem? Did you personally not get it right the first 2 times?
No, but she was very used to having no chin, basically. And when I put in a certain size chin, it was too much of a change for her. She just could not adjust to that type of face.
My husband was very happy with the first one. He felt I looked much more youthful. I had a stronger chin. I had some sort of a neck now. I had definition. I myself was not happy with it.
Maybe what we need are expandable and contractable chins. The latest.
No, she was very, very realistic.
I was very confident in Dr. Colen. Dr. Colen has a type of personality where she has a lot of perseverance. She's a perfectionist.
Good. That's what you want
and
from your
I feel
doctor?
very loyal to her.
How do you like your chin today?
I love it.
Let's hear it for that chin. We'll be right back.
I love Dr. Colen.
We'll be back right after this.
We kind of have an attitude now, which is, it's there, I better fix it. You could actually feel okay about yourself with lines.
But actually, if you're 33 and you start seeing lines and it bothers you, I think it's smart to talk to a doctor and see what can be done. And a dermabrasion in a 33-year-old around the mouth or a chemical peel, it's perfectly acceptable, and it is done in the office. And most plastic surgeons do have an operatory in their office and could be done safely.
All right, let's move to the next caller. Mary Rose, South Philadelphia. Hello.
Good morning.
Good morning.
I had a question about a tummy tuck.
Yeah.
I have really bad stretch marks. I had a child 4 years ago, and I briefly inquired at one point about surgery, and I was told that sometimes the scars from the surgery itself can be just as bad as the stretch marks. Is that true?
Are there circumstances under which they can be just as bad as the stretch marks?
If you get an infection, or if there is some problem with the skin in the area, you may get a wider scar, but you will not have multiple stretch marks. And I think Leslie can probably attest to that, because she had a tummy tuck.
As far as the scarring is concerned, please understand that the scar goes from hip to hip over the pubic area, and it's really a hairline scar. So by comparison to someone who would feel terrible about their stretch marks, this is so minimal that it's not even noticeable.
And right next to you have a woman with a question, right?
Well, yeah, I've been questioning my gynecologist for the last 5 years or so about a tummy tuck, mainly because of, like she says, it looks like a map down there with all the stretch marks. And to me, this is all mental, that it would help me. Nothing to do with my physical, that it would make my physical. To me, when I look in the mirror, my husband says it's fine, my friends say it's fine, but to me, it sticks out like an eyesore. And I'd just love to have it, but I'm wondering about, like, it's elective surgery. Does anything cover it? You know?
Yeah, the word cost.
Everything is elective surgery unless it's an absolute emergency that you have to save your life. Some elective surgeries are covered. Most likely a tummy tuck will not be covered.
What's
by,
the basic cost of some of these procedures?
Yeah.
Let's run.
Could be anywhere from $3,000 to $6,000 depending in which city
And
or
how
where
much
you
was
go.
yours?
Well, let's see, between the breast and the tummy was probably about 10, 11,000. But let me tell you something.
No wonder you look so good.
I have to tell you something. I do not have a lot of money. I had to work very hard. This is something I wanted since I was 21. That's how badly scarred I was. I felt that I was personally very deformed looking. And it was well worth working hard and going for.
We're totally out of time right now, but I think we've given out some good information. I want to thank all of you, and really thank you again for sharing your stories, coming down and being on television. Good luck and safe journeys back to the scalpel.